Hi, welcome back, everybody, to the HMH Agile Institute YouTube series. I'm your host, Beth Gregg, and today I'm thrilled to be joined by Regina Foley, President of the Specialty Hospitals, Clinical Services, and Chief Nurse Executive. Welcome, Regina. Thank you so much for being here.
Well, good morning, Bethany. Good to see you.
Good to see you too, as always. I know that you've had a long, incredible journey with HMH, and it goes well beyond a career choice for you.
Right.
I know it's personal. Can you take a few minutes to share with our listeners why healthcare?
All right. I think it helps with, being a nurse is in my bones. That was just something that I felt like I was born to do. And then blessed early on after school, started working at Jersey Shore and had a great experience. It really started from that, honestly, and then moved to other hospitals and different roles and different things along the way. And here it is 38 years later. I can't believe as I'm saying that, 38 years later. And I've loved it. I mean, there are days and times or segments that I'm like, oh my gosh, can we get through it? Is it going to be okay? But I always think of like I'm a glass half full and positive. And as healthcare has changed, we need leaders to adapt, right? And I feel like I've always been in the right place at the right time doing the job that's needed at the time. And to your point, it is personal. I live in New Jersey, educated in New Jersey, raised my family in New Jersey, and anyone I care or love comes to us for care. It could be in Bergen County or it can be in the southern part of Ocean County. Geography doesn't matter. So it is quite personal. I want our hospitals, our acute care facilities to be the best that they can, as well as all the efforts and what we're doing in the ambulatory footprint. We've expanded that in recent years. So it is personal. It's not, I don't want to say it's not a job, but it's not for me. I love what I do, who I do it with, and where I do it. So things like today I feel like it just rounds it out. It's another tool in our toolbox in what we're doing to take care of our patients the best that we could take care of them.
You mentioned something that stuck out to me about needing adaptive leaders. And adapting and an iterative nature to the work we do is at the core of Agile science, always learning by doing.
Yeah.
And thank you for your help and support developing the nation's first structure for innovation units at the hospital level.
Yeah.
So I remember it's been about a year, so the timing is perfect to kind of talk through our journey with the innovation units. Jose came to me with this idea that we would have these units carefully selected by our nursing leaders and with your guidance as well. Yeah. So tell me a little bit about how that idea came to fruition.
Yeah. I think I would start with, and you mentioned it, the whether you're in a leadership position or you're not, anyone in healthcare, right, is the definition of endurance, the definition of resilience, because we're all motivated by the same thing, how to take care of someone. Right? What is it that we need to do in order to have the best outcome possible? Because that's your mom, your sister, your brother, your husband in the bed, right? So the pressure is on the leaders because they're the executors of action, right? Yet the majority of what we do is meant to be, specifically in the innovation units, which I'll talk about in a second, is this movement, and we have with process changes and change that we're doing that are closest to the bedside. It starts with the change agent of the leader effectuating the change. But the action comes from those that are literally touching the patient. The techs, the nurses, the physicians, and everyone else who's interacting with the patient in any way. So what I'm excited about is, I will say we can't talk about Agile and innovation use without saying thank you to Dr. Jose Azar. He came here, I feel like he's been here a lifetime. He's only been here a couple of years. And with that, it was one of the reasons that he came, was we were poised for continued greatness to happen. And the foundation of that in the patient arena is how we're adopting technologies or changes occurring at the patient level, at the patient bedside level. So the philosophy or methodology of Agile is to be transformative, to be innovative, to think clearly, to don't do it for the sake, because we've always done it that way. And we are masters at workarounds. I live it myself. We are masterful as an industry on the process says one way, and we don't like that, and we work around it, and we cause all of these like holes to be in the cheese then, and then we can get into trouble. Which I'm excited about these innovation units is foundationally they were selected by design. Tremendous leadership that have a lot of retention, strong retention on those units, low vacancy rate, and the attitude and personality to adopt change. And it's not for the sake of making change happen because you like the word. It's we have a process change, we try it, we see if it works. If it doesn't work, we move on. We don't stick to it and say, oh no, we should do it another 30 days. We need to do another 45 days. That's not the point. Our industry is changing, literally evolving. I'm not kidding you, day by day. If we were having this chat a year and a half ago, I wouldn't have said virtual nursing units. I wouldn't have said that we ever could have done a virtual technology that would, a nurse could be a partner to our nurse boots on the ground at our hospitals. And we're doing that today. Never would have thought that we're going to, age-old, industry-wide telemetry strips. We have many patients on telemetry for the right reason, but every minute of every day we have these strips because we see what's happening. They have to be pulled off. It's paper. They have to be pulled. They have to be put on these telestrip things, and then they go in the hard chart. Well, the physician's not in the hard chart necessarily. They're on Epic or a provider. So those are just two examples of adopting technology or process changing of what we need to do to be wiser, smarter, more efficient, and quite frankly, what we're doing to take the administrative burden away from those that are touching the patients at the bedside. Is that relieving that administrative burden? The only way this is happening is to embrace an agile methodology. It's that kind of visceral, in your belly interest to be innovative, to challenge the status quo, to ask questions, to be transformative, to think that's my sister in that bed. That's my next door neighbor who I see every day. What is it that I need to do to take care of them? And so these agile units are poised for that environment to occur. So in the last year, within this past year, we've launched these innovation units. They're at every single one of our hospital sites. Again, amazing leaders, transformative leaders that are leading these process changes. Some things we're seeing what works very quickly, and others are like, you know what? It was a good idea, but it just doesn't translate. It just doesn't work. And then we redirect and we move in a different direction. That's what's so, to me, energizing and inspiring about these innovation units, because that's the platform where we're going to challenge things of what's, going to work or not. And quite frankly, what it does to set the tone for HMH. That's the other thing. We are looked at nationally. A lot of eyeballs are on us, and there's always pressure associated with that. But we are doing things really, really well. And our results are showing for it. Something like a Leapfrog A or star ratings or accreditations that we've achieved. Not every facility and every healthcare agency is doing that nationally. We are by design. We, almost 40,000 large now in our company. With, on the nursing side, the lowest vacancy rate, I think, known certainly in the Northeast area. Our nurses come and they stay. They don't have to stay in the same unit, in the same facility, but they stay in HMH a long time. That's how you get traction. That's how you get momentum, because those nurses are embedded deeply within HMH, whether it be the facility that they're in or within our company. And that's where the juice comes out of it all, because you have, nurses that are working, they're self-actualized, right? They're just They're not worried about the basics, but they can actually think. And we've had a lot of experience in this past year. I mentioned administrative burden, all the changes that we've made to the Epic platform, all the adoption that we're doing with technology, and more to come, I would say, by the way. Nothing ready for right now, but technology does work at the bedside. We just need to be smart with the decisions and in the right place at the right time. So I know it's somewhat of a long-winded answer, but I would say from a future perspective, the foundation, don't underestimate the impact of these innovation units, because what happens with an HMH, it's going well on that unit. Well, how do I get that? If it's working there, well, I want that too. And then it organically changes and transforms in a facility, and that's where you get the patient outcomes that we're seeing. Patients that aren't getting infected in the hospital, that they're not getting pressure ulcers in the facility, that they're being discharged to home, that they're not boomeranging and coming back. We discharge them packed up, they're good to go, they have their medications, the family knows how to treat them. If they need to come back, certainly they come back, but we want them to go and then to stay home. All these things only happen when you have a self-actualized team, and it's a blessing. It certainly is a blessing here at HMH. But in the job I'm in, I'm motivated by that, and honestly, pressure to make sure that we are retaining, and that we are recruiting, and that we want best in class. I mean, that's right. That's who we want for our families and friends, and that's what's here. So the innovation units is the foundation to allow all of that to occur.
That's perfectly said. Thank you for your comments. And I was jotting down notes because you hit on so many key concepts that I'd like to just summarize for our listeners. First, we are obviously in good hands with leaders like you at the helm. And as you mentioned, HMH is seen nationally as being at the forefront, really, of healthcare transformation. And having units like the innovation units, that is certainly building on our foundation to get us there. But it starts, I think, what you mentioned, with a shared mindset, right? Just starting at these units as a small test of change, but we'll be scaling sooner rather than later, because that mindset and that excitement only grows. And so I'm really excited to continue on this journey with our units. We've developed, starting with an inventory of resources and expertise. We have a multidisciplinary team with physician and clinician champions helping to support the work. We have developed an idea intake form for any team member across the entire organization or provider to scan a QR code and let us know where they see the opportunity, what they need. Because to your point, the subject matter experts are at the bedside and they tell us what they need, and we're here to support that change and bring the innovation and the technology to them to help them achieve their vision for excellence that we all share.
Could I add one thing?
Yes, please.
As you were saying that, I want to make sure that those that are listening is the uniqueness of these innovation units. It's not, I'm here a long time, right? I'm a career HMH loyalist and love it, by the way. So I've lived and led many things that at times I would say, I'm doing it, I'm just not feeling it though. I get it, I understand it, and I know, we just need to deliver. I don't know. I'm like 80% with this, not 100%. With the difference between other, I would say, initiatives or things that have been rolled out in our industry for, honestly, decades now. The difference between those and the innovation units is that we have the small tests of change are happening day to day on these units, right? It's happening right now. And I used the word organic before. As this is a cultural philosophy. It's not, we're implementing this, we're going to track it for 12 months, and then we're going to move on to something else. This is a cultural embedded methodology that within any wall of HMH is embedded in the philosophy of our company on how we're transformative, how we're innovating, what we're doing to, if something's not working or it's taking too long or the process just seems to be bad, this is when you're poised to say, like stop the insanity here. If that doesn't work, why are we doing that? The telestrips are a good example. for decades. You take the telestrips off, you peel you stick it on the thing and you put it on the chart. Talk about a waste of time. Waste of time, waste of resources. The monitor tech has other things to do. And I would even say that our physicians they're going to the nurse or another provider to see what's going on. They're not necessarily going to that. That's a good example of a process change that needs to occur. Now, in this situation, we're going to leverage technology to do it. The whole thing's going to be on Epic. Hey, that's great. But I don't want the listener to hear, okay, innovation, let me get that in my mind. And here we are in we're in September now of 25 and what are we going to be doing in a year? I can say we're going to be having the same conversation in a year, but it won't be the innovation units. Then it'll be in a broader sense, and we could be talking about a hospital, a region, how we've moved from the acute side to the ambulatory side. So I don't want the listeners to have this misnomer, okay, I'll listen to this now, I'll pay attention to these innovation units, let me know I need to do something, and if the deck chairs change, well, just let me know where I need to move. That's not the case. We're an agile methodology embracer because it has long-standing results. And the launching of these innovation units, it wasn't like the network or the corporate did XYZ, right? It's not a top-down approach. The action's happening at the hospitals and closest to the bedside. That's where this is from, and that's why I'm so behind it, because that's Gemba to me. Like, the action is who is interacting with the patient. I have a lot of humility, recognition. I'm quite humble on knowing, like, I may be somebody who effectuates change and kind of makes things happen, but the action is happening where the patients are. Foundational respect, admiration, and understanding there. So therefore, we're going to those experts, though. This is why these innovation units are so pivotal, because we're going to these units and asking and talking to these monitor techs, unit secretaries, providers, nurses, and PCTs, what works and what's not working, and how are you feeling about it? So I didn't want to misrepresent the listener today to say, oh, great, it's good about these innovation units, now we're going to move on. No. I would say the Agile methodology and the framework are embedded now, or becoming embedded within HMH, and that's a cultural transformation. So I just didn't want that opportunity to go away, because very often we're very, as an industry, no shade, I get it myself, we're transactional. Do it, right? We have something to do now, do it, make it happen, and move on. That's not this. That is not this at all. This is in the fiber of what we're doing day to day, and challenging that status quo to say, well, this doesn't. That's why we need the smart people on these units. Well, we've always done it this way. We've done something this way, but that seems like a little antiquated. Can't we change that? Those are great examples of where the transformative stuff comes out.
Great point. Thank you for bringing that up and highlighting that really this is just the tip of the iceberg. We are not checking the box. This is embedded and part of everything we do every day. It's a mindset that we will aim to share over the years as we continue to grow. So thank you for highlighting that difference from other maybe historical initiatives or projects that our listeners may have been involved in over the years. This is our new norm.
That's right.
And I would also add, as we're talking through meeting people where they are at the bedside, hearing from them as the subject matter experts, the Agile framework allows us to accelerate that rate of change because, as you pointed out so eloquently, we accept that when things don't work, we move on.
That's right.
Because a very unique component of that framework is to call out not only what success looks like in the beginning of an initiative or a project. We all are very familiar with setting goals, setting targets, but as part of that, we set up what does failure look like? And who's responsible to let us know it's not working, we've met criteria, so that it's not personal, because I'm guilty of it myself. I fall in love with a solution I might have stood behind over the years, and I just keep trying.
Yep.
We're tenacious as nurses, as healthcare providers, as leaders, and we want it to work. But if we set up at the forefront, before we start sprinting or trying out something new, what does failure look like? It's not personal. It's just we met criteria. We aren't wasting time on ineffective solutions. We are jumping off the hamster wheel and moving on to something that might make a better difference. And once we understand what works, we can scale it beyond the innovation units, beyond the units at the hospitals, outside of HMH even. We can think big.
Right.
So we are well suited, to your point, to start that tip of the iceberg, but keeping in mind that foundation of the framework that allows us to get there faster.
Can I make a comment?
Please.
And I think that the term, and this seems heavy, right? Heavy the way I'm saying it is, and I'll just give my own experience. The fastest or quickest acceleration of change that I've led or experienced my career is based out of a failure. It's based out of when it didn't go the right way, or it didn't have the outcome that you wanted. I mean, very often, probably I would say the majority of the listeners, it's almost like their why, right? It could be an experience that somebody had, a family member had, or something that motivated them to go into healthcare, is that our industry reacts beautifully because we are overachievers. We want the core, we want to take care of everybody, right? That's just at the core. I don't care what job you're in, what you're doing here at HMH, we care. We care about people, including one another. So when it goes right and it goes well, it's like we assume that, right? And it moves on, we can increase and accelerate, et cetera, et cetera. But when the momentum really occurs and when the action really occurs is then, God forbid, if we have a bad outcome, or we're anticipating X and we really get Y and Z. And that's when I guess I want to make sure that the listeners, failure is just part of what we do. We have to embrace it and be okay with it. And not, because if you don't, that's not a good recipe for a lifelong career, right? Because everything is so personal. And by nature, we just are here to do right? And I don't want the listener to think failure is not an option, because again, in my humble career, that's when things happen. Like, you get great clarity. There's, immense clarity when it hasn't gone our way, or when the outcome wasn't what we anticipated. Then you can really see where you can get rid of the noise and the nonsense and what needs to happen to effectuate the change. So I think it's the humility and the recognition to know we're here to just do right. We are here to just do the right thing for the patients and anyone who's here within our company. This environment, or whether we're going to call it, the innovation units that we're talking about today, that's where I would say sprawl is going to occur, right? We're talking about units today, but in a year we're going to be talking about a network-wide impact, including in the ambulatory space. We can only get there if we can't be afraid of change, and we can't be afraid of failure, because that's how the action really occurs. So obviously we don't want negative patient outcomes and bad things to happen. In reality, it does. That's where these innovation units are kind of the protectors of the front to see, well, that's not going to work. There's too much jeopardy, or there's too much risk. Obviously, we're going to back away then, right? So again, it comes from a place of just doing right. And it starts with us as a team, how we treat and care for one another. And that translates to our patients. So I just didn't want the listeners, Bethany, to think, oh, it's like fairy tales and rainbows. It's not. The reality is that healthcare is hard. It's hard. It's adapting to technology, whether it be medications, treatments, family expectations, patient expectations, our providers' needs, et cetera. So I would just say that's why I'm so respectful and excited about the Agile framework, because there's probably not a stronger foundation for our team members to work from, honestly.
Yeah. I heard so many important pieces and components of the Agile framework built on a foundation of psychological safety. High reliability really aligns perfectly well with Agile. One complements the other. Agile really the vehicle to get us there, because we already have this very strong foundation and culture of safety, our just culture of speaking up for safety. And if we can't learn from when things don't go as expected, right, how can we move forward and continue to evolve with an industry that's rapidly changing all the time? Correct. So well suited, as you previously said, to evolve with the industry quickly.
Yeah.
We talked about your why, We talked about the units as the tip of the iceberg, as a foundation for our organization to move forward and to really establish ourselves as being at the forefront of healthcare transformation. Where do you see Agile taking HMH in the future?
Yeah, I love that question. I think, and it's a couple of answers. One is on the acute side, meaning acute hospital side. I see it transforming the timeliness, the efficiency on how we're rendering care in our facilities, right? Expectations of patients and families have never been higher, really. I mean, you hope that the body moves as quickly forward, right, in the healing process or adapting to medications or treatments as much as the patient or family are expecting those. So I would say Agile is again, a foundation for our acute care team to rely upon how we're managing expectations, how literally we're rendering care, embracing technology when we should be, and not being fearful of not embracing technology, because that's the world that we're in, and leveraging it, right? Leveraging it. And then, so it's on the acute side, I feel like I can tell you that, compromising or slipping isn't even in the DNA of the company, right? It's always like you have an A, well, how about that A plus? And is there a plus category, right? So that's down the acute side. Then I see Agile. I do see us moving to the ambulatory environment. I do. And the ambulatory environment, whether it be the medical office buildings, different sizes, scale, throughout many parts of our state now. But we're rendering a lot of care in those ambulatory spaces, and that's going to continue to increase, right? It's the sickest of the sick and the high acute that are in our hospitals. But if you can do something ambulatory, then you're going to do it ambulatory. So Agile is well poised for the ambulatory environment. And then the third, I would say, is philosophically, is we recognize we can't be everything to everybody. So I think in our company, and if our CEO, Bob Garrett, were sitting here right now, he'd be doing the affirmative nod. We have a philosophy to partner, right? Knowing that if somebody's doing it wiser, smarter, better, well, then how do we do that? And if we can't implement it, well, then can we partner with them in some way? Or strategy for the strength and the growth of the company and the continued transformation of our company. So the third kind of leg to that question is the philosophy. Agile is very, in the sense of today, we're talking about Agile impact of where the patients are. And I reference the inpatient, acute, and then the ambulatory. I would challenge the audience, those listeners, is that same philosophy. I'm living it day to day in how am I thinking about different partnerships and different strategies for a company to continue to be successful, to continue to be number one, continue to have the strength and the presence in the Northeast market, to continue to be looked at nationally for different things. We're only doing that because of our philosophy to be adaptive. Well, you can only be adaptive, right, if you're innovative. And that is the tenets of Agile. So as you ask the question of what does the future hold, I think we're really well poised on the acute side, hospital-based care. My sense is, if we're talking in a year, ambulatory is going to be more of a conversation than it is today. And then I can tell you from an executive leadership presence or perspective in our company, it's what moves us. It's almost like a visceral connection every day on how we continue to adapt and evolve as a company, because we want to continue to be a great employer and continue to be competitive in the market and continue to render great care. Well, that doesn't happen because you just check off the box, to your point before, like have a checklist and you move on. I'm more motivated now. Like we have many hospitals that I think 7 are leapfrog A's and B's, and only one hospital, HUMC, congratulations to HUMC, is 5-star rated. We have other hospitals that are rendering 5-star care. How can my influence or my opinion or my presence help all those other hospitals in getting 5-star? Because again, our families and friends are here with us. So that's like a connection full circle on the personal piece. And that's why I'm really encouraged by the Agile methodology.
Thank you. And in closing, I love that you mentioned partnerships, because this might be the perfect time to kind of talk through the partnerships that we've already aligned very closely with in the development of the Agile Institute units. So partnering with Bear's Den as a start to really help us assure that we are taking the right approach, building that strong foundation, and also to assure that we have pathways of ideation that go beyond the ideas submitted by our team members are only one pathway. We can partner with vendors. I have a meeting with BD coming up, and we're planning our first innovation summit to hear how we can think outside the box to achieve improved outcomes for our patients. And really thinking through, you mentioned the ambulatory space. I just met with Dr. Binkley last week, where he mentioned you ought to add some ambulatory locations to your inventory. So great timing. We're working on it. More to come for our listeners. Tune in to hear how we will continue to maintain our space as being at the forefront of transformation at HMH.
Can I add one thing you said about, and I'm not giving BD a plug, it's just that we use BD pumps, is BD reaches out to us on how can they be stronger.
Yes.
Right, they have a nice pump and that's good, but I'd love to see more interoperability. And they're saying, well, how do we do that? Or what's important to the nurse? And then I go to bedside nurses and say, can you please translate here? What's important? Because you're doing it. I'm not on a pump every day, but that nurse is using that pump every day. That's a good example of a partnership, right? It doesn't mean that we have to own the BD company. We don't have to make the pumps, but we need to partner because we want that technology to be the best in class for in this situation, our nurses to utilize to administer medications to patients. So that's a very, very good example of a partnership.
Yeah, thank you. Excited to be part of that. And it goes right back to where we started in our conversation, going back to the subject matter experts at the bedside to tell us what we can do to support innovation and change and excellence in healthcare.
Agreed.
Thank you so much for joining us today. Any other closing comments you'd like to add?
No, I'm flattered to be asked, and appreciate, for those that are listening, appreciate you spending time and just protecting some time for yourself and having hopefully a better understanding of what the Agile units are doing at each of our hospitals. And stay tuned, because we'll be moving more of an expansion within the hospitals themselves, and then moving to the ambulatory footprint. But I just thanks for allowing me to hang with you a little bit here today, Bethany.
Well, thank you. And thank you to all of our listeners for tuning in today. Stay tuned for more to come, not only with innovation units, but with the Agile Institute at HMH. For any questions, please reach out to the Office of the CQO at hmhn.org, and stay tuned to hear how Agile can help make a difference for you.